All right, has everyone pretty much cast their votes? I think it looks like everyone's phone's down a bit. All right, this is a very big pleasure for me to introduce Keith Donnelly from Keith's Closet. Now, I met Keith probably about a year ago. He is doing some amazing stuff on the other side of clinical care, which is looking after more people's well-being and making sure that they've got the essentials in life, particularly when they have been admitted or are seeking help through an acute mental health service. And I use this really terrible analogy. You know, imagine getting off a long haul flight and your luggage is lost, and all you want to do is clean your teeth and have some clean undies. Well, you know, compare that to being admitted emergency into mental health care and you've got the clothes on your back and, you know, they could be soiled in some way and you've just lost that dignity, that autonomy. So that's where Keith steps in, and he is better off talking about it than me, so I'm going to throw to him now. Up your pop. You want to use this or do you want to use that? What's easy to do? Oh, there's people online.
Oh, was there? Okay,
Yeah.
all right. Yeah, sure, I'll use this then. That's right, yeah. Hi, everybody. My name is Keith Donnelly. I'm a mental health nurse here at the Aurora Centre. I've worked in mental health ICU and also at the Carlo Centre before I went into community mental health, where I've been for the last 4 years. As Sam mentioned, we met each other about a year ago, and obviously Matt then as well. And I'd just like to say a massive thank you to you both for having me here, and obviously Julie as well. It really gives me great pleasure to share this room with some amazing people. But a little bit about me. So I moved to Australia 7 years ago with my wife and children. Worked as a mental health nurse back home in Dublin. And one of the things that I always noticed was that although like we give our patients really amazing care and the care plans are great and the doctor reviews are great and the discharge plans are all great, we often miss the most important thing, which is the presentation. How do you actually look? We're looking around the room now and everybody's made a beautiful effort to look so well today. And the lucky thing was, I guess, like we had that opportunity. We had some lovely clothes in a wardrobe when we woke up this morning to make the effort and make ourselves look good. For a lot of our clients, they don't have that. Again, many will arrive in the hospital either in the back of a paddy wagon or in an ambulance, often involuntary, with no friends or no family to call upon in a desperate time of need. So when I first came here, I noticed again, like it was much the same issue. There wasn't any supportive clothing. Nursing staff often found ourselves wandering around and looking into presses and storage spaces to try and maybe find something better than what the patient might have had on, whether it was soiled or torn or stained or just it was disgusting and fit for the bin. So I spoke to my operations manager at the time, who was really big on innovation himself, and he was a really amazing guy who really supported me in my mission. So my mission was to literally transform a seclusion room into a walk-in wardrobe store room or a call-out centre where our patients could actually come and access new and high-end clothing, toiletries, sanitary items for ladies, everything and anything that you or I would have in our wardrobe. And that opened in 2019, and with great plans to expand, obviously, to other facilities. And obviously COVID hit, and well, we all know what happened then, enough said about that. But our plan obviously stayed in focus, and we managed to get a mobile wardrobe van. I have my own space now, like just around in the car park, my own official space. You might say a big van around there, but on the inside of that, we actually have units, and it's literally a mobile wardrobe where our patients often come for doctor's review, or they may need a depot or whatever, and that's theirs to access anytime that they come. And I guess not only are they taking away some beautiful clothes, it's often helping their stigma, their self-confidence, and sort of giving them the TLC that I guess like that doctors and nurses, we can only do so much, I suppose, like in the terms of caring for them. Like, so this is kind of like a different level of care where they can go home with beautiful clothing, and many won't be able to afford in the first place. So, so the mobile wardrobe has been active now for 2 to 3 years, and we've done some outreach services out town and other places. And then most recently, 3 weeks ago, we opened up a closet in St. Vincent's Hospital. So our plans going forward are to obviously expand our service to other mental health facilities. We recognise it is a universal issue, and the difference it's making to clients is really, really incredible. We all know, like I said, what it's like to have a nice outfit and to dress up and feel special and look good and feel good, and our clients should be treated no differently. And we're just really looking forward, like I said, to expanding. We've got another 3 planned for next year. We became a registered charity as well last year. So it's building, and I guess I'd love to do this full time. It's very hard to juggle a full-time job as well as this as well, because this is definitely a full-time job in itself. But I absolutely love it, and that's what keeps me going. I guess things that we really need, and one of the reasons why Sam wanted to drag me across here, we know we have lots of brains in this room, and one of the things that we're really looking for, I guess, is some people like to come on board and maybe help us with the research and the things like to kind of maybe, I don't know, like maybe build some sort of platform, some map like that we can recognize like what we need, like how we got to get it from X to Y, and just have a better service, like and be able to actually show figures at the end of the day or the end of the year, and show data, the amount of people who are arriving into hospital availing of our service, who otherwise would be maybe given a white gown. And I'm not sure if anyone here has had the pleasure of wearing a white gown, but it's certainly not up there with the best of outfits ever designed. And would certainly do a good job of dragging anybody's dignity into the floor. So it's about treating them as one, treating them with all the best medical care, the best mental health treatment, but also being able to provide a nice outfit that they're going to feel good in. I think that sort of sums up where we're at the moment. So, as again, thanks very much for having me, and thanks for listening.
Thank you. Thanks so much, Keith. I do recommend having a look at Keith's website, and he's got a fantastic video on there as well that really showcases what they do. And I was very lucky to be invited to the opening at St. Vincent's at Caritas, and it was just incredible to see all these patients wandering around going, what is this? And, oh, can I eat this free food? But then also once they heard what the service was, just the sheer delight. One person had a shirt inside out, clearly quite stained, and he was just so excited that he was going to be able to have some clean clothes. And of course they're admitted for 30 days. So you think if it's 30 days wearing something not that great, you know, it can give a lot of power. It can be very powerful. All right, well, I guess we get to the next part of what everyone wants to know then. Who's won some cash money? So I'd like to introduce Associate Professor Suzanne Sheppard-Law, who is in a very interesting position and very unique to the LHD, and that is a Professor of Person-Centered Nursing. So Sue, if you want to come up and give a bit of an intro to what you do, and then tell us who's won some prizes.
Does that work? Yeah. Okay. So that's a little bit hard to follow on from. What a wonderful initiative. That's just amazing work. I really congratulate you, and I'd love to hear more, perhaps a bit later. So as Sam said, my name's Sue Sheppard-Law, and I started here in April as, so it's person-centered research. So there's a lot of shift and focus towards bringing the care to have more of a model of person-centered practice. So it is kind of a little, it's a first, and it is a little bit unique, and it's very exciting to be back at Prince of Wales and to be able to really drive this research agenda forward. So I worked as a CNC here some time ago, It was my first position as a CNC appointed at Prince of Wales, so it's kind of nice coming back and to the Ramway precinct. And I've also, my first position as a research fellow was at the Sydney Children's Hospital, so delighted to be back and hope to drive research forward and hope to see more nurses presenting next year at the TOE Awards. So that's me. Thank you for the committee for allowing me to come and do the best job for the day, which would be helping to present the awards. And congratulations to the committee for pulling together such a fabulous program. Unfortunately, I didn't get to see this morning's presentations, but I did see this afternoon, and they were just really some groundbreaking, innovative work being undertaken. So congratulations to everyone who's submitted a abstract. Posters were fabulous. I've had a look at all of those and the presentations were great. So can we go for the awards?
So they're just so the first, where we do this sign first, so division winner. Poster.
And I'll
Yep, we've got them.
Who's doing them?
You are.
Okay.
So if you want to read them out, then.
Okay, so starting with basic science division. So the division winner is Isabel Williams from the School of Psychology.
Thank you.
Don't go anywhere. Isabel, you also won the People's Choice Award, so double win. So well done.
Where's the check in the month?
I know we'll talk about that afterwards.
Yes. So cash prizes as well.
Yes, so
Coming.
see me afterwards. And we'll fill the form. Yeah.
Fantastic. Best poster is Taylor McCutcheon from the School of Psychology as well. Is Taylor here?
Right here. I'll email her. That's the one. Yep.
Okay. And the best poster for People's Choice was Afra Kassim. Next page.
Yes.
Okay, great, thank you. In the clinical division, so the winner is Dr. Hannah Ubel from the Children's Hospital. Congratulations. Thank you. Thank you. Well done. Oh, and Hannah, maybe come back. Hannah also won the People's Choice Award, so congratulations. Double win. Best poster in the clinical division was Dr. Rochelle Langford. Is Rochelle here? And for the People's Choice, it was Dr. Arella Hefferon Marks. Hefferon Marks. Yay, well done.
That was just a handshake and then we'll fill in a form later.
Congratulations. Yeah. Okay, for nurse, midwife and allied health division, the winner is Sarah Grace Pagantino. And stay here, Sarah. This week is consistent. So you also won the People's Choice Award. So we've done congrats. Okay, and keep going. Yep, okay. For the Independent Learning Program and Honours Division, first winner division is Jason Dafar. Congrats, Jason. Fantastic. And also don't go because Jason also won the People's Choice Award. So congratulations. Great. For the ILP and Honours Division, best poster was for Christopher Chan. Thanks, Fred. And People's Choice for poster in this division was Anise Fulvia. Case presentation. So the winner is. Oh, sorry. Okay, you're out here. Congratulations. Thank you. That was a bit slow. Yeah. So the division winner for the case presentation was Dr. Dominic Vickers. It was really lovely. And also you won the, yeah, you also got the People's Choice Awards. Thank you. So thanks everyone. I think
They come see me and fill in a form.
yep, and perhaps a congratulatory clap for all our winners.